Good morning, everyone. Welcome. I'm just going to give us just a few seconds to make sure everybody is logged in, and then we will get started. So maybe 30 more seconds. All right, I'm going to get started. I know sometimes it takes some time for everyone to come in from the waiting room, so I just thought we'd give a few seconds for all of that transfer to happen. Welcome, everyone. My name is Meg French, and I am the Executive Director of the Stephen Lewis Foundation. And before starting today, I just want to say that as an organization based in Canada, the Stephen Lewis Foundation acknowledges that our presence here is a direct outcome of the settler colonial state, whose policies of expulsion from the land and cultural genocide continue to impact Indigenous communities today. The 94 calls to action of the Truth and Reconciliation Commission reaffirm that the treaties with Indigenous peoples must be lawfully honored. We are all treaty peoples and are responsible for honoring and upholding these agreements. The Stephen Lewis Foundation also acknowledges that oppressive and inequitable socioeconomic and political systems in Canada continue to perpetuate this legacy of racism, intergenerational trauma, and structural inequity, and that this legacy is directly linked to the disproportionate impact of HIV on Indigenous communities within Canada. So the Stephen Lewis Foundation is committed to the principles of social justice, equality, and solidarity with our community-based partners as they face the continued effects of HIV and AIDS pandemic in sub-Saharan Africa. And so consistent with those values, the SLF commits to a journey of ongoing learning, reflection, relationship building, and solidarity with Indigenous communities in Canada. So thank you all for joining us today, and welcome to our second Pride Talk. We are going to hear today from Kennedy Otieno Olango and Herbert Ayesiga about their work in Kenya and Uganda championing mental health programs for LGBTI communities. At the Stephen Lewis Foundation, we are really committed to ensuring that our supporters hear directly from our partners. We know that community-based organizations are really best placed to lead the efforts to champion the health and human rights of their communities. And so therefore, they are really best placed for you to hear from and to talk about their work and their experience. And so just for some of you who may be new to the SLF, who are joining us for the first time, I just want to let you know that, based on that principle of ensuring that community and grassroots-based organizations take the leadership and have the resources that they need to lead change within their community. We at the foundation, the foundation was created, therefore, to get resources directly into the hands of community-based organizations, and particularly those who are working on the front line of HIV and AIDS pandemic in sub-Saharan Africa. The work of our partners is a holistic work. It supports women, orphan children, LGBTIQ communities, grandmothers, and people living with HIV and AIDS. And what you're going to hear about today, while focused specifically on mental health work, I know that you'll hear from Kennedy and Herbert about the holistic nature of their programs as well, and the importance that that plays in providing mental health support. And so that kind of work includes stigma-free health services. It includes peer mentorship, economic support, human rights training, legal services. There's also activism that happens to advocate for change in policies and in communities as well. At the foundation, we have been supporting 15 LGBTIQ community-based organizations since 2017. We've been supporting the organizations in 5 countries specifically, so Kenya, Uganda, Tanzania, Rwanda, and Democratic Republic of Congo. And last year alone, these LGBTIQ partners reached more than 40,000 individuals. But what we've also heard from our partners, and we know is very important and critical, is that there is an urgent need to increase the support for LGBTIQ activists and organizations in sub-Saharan Africa, and that this support is needed in order to ensure the sustainability of organizations and in order to ensure that they have the resources they need to continue to provide that holistic support and to act and to advocate for change in their communities. And so in response to this, earlier this year, the foundation launched our Partners in Pride campaign. And so this campaign aims to raise $3 million over the next 3 years, because we both want to scale up funding for our existing partners, but we also want to extend support to new partners across sub-Saharan Africa. And the aim is to reach 100,000 LGBTIQ individuals a year. So if you'd like to learn more about the campaign, or you'd like to support the work of our LGBTIQ partners, please check out our website at stephenlewisfoundation.org. There's also a link in the chat that you can click on as well. So I'm going to stop there because I know that we want to hear from Kennedy and Herbert. So let's jump right into this Pride Talk. We will have a discussion moderated with Kennedy and Herbert, and then we will aim to hold time at the end for questions from the audience as well. You will see that there are 2 functions as part of Zoom. One is the Q&A function. And so please, if you have any questions, post them there and we will try to get to as many as possible. There is also a chat function. And if you have any technical issues, our team will try to help you resolve those, but you can post those issues in the chat as well. And the team will see anything that you post there. So I know that I'm excited to hear from Kennedy and Herbert. So let me start by introducing them to you. Kennedy Otieno Olango is the co-founder and program manager at Men Against AIDS Youth Group, MAAYGO, which is a community-based organization in the Lake Victoria region of Kenya. And it's dedicated to the health and human rights of young gay men, men who have sex with men, and male sex workers. Kennedy is a leader and a community mobilizer with extensive experience working in the movements to support sex workers and gay men, other men who have sex with men, and transgender individuals. He's trained as a community paralegal and an HIV testing provider, and he represents gay men, other men who have sex with men, and transgender communities on a number of committees and advisory groups, both in Kenya and across the continent. He's also a global advisor member at Interpride and a regional coordinator of Western Kenya Pride. So welcome, Kennedy. Thank you so much for joining us today. Our second guest is Herbert Ayesiga, who is an LGBT activist, researcher, and social worker by profession. He is the programs director at Icebreakers Uganda, a nonprofit organization for LGBT persons, which is focused on sexual health rights, advocacy, and community mobilization for HIV/AIDS awareness and prevention for all LGBT Ugandans. Herbert pioneered the first research on mental health issues within the LGBT community in Uganda, and the See the Invisible campaign, which is aimed at raising awareness of mental health issues. The campaign also ensures that those at risk receive proper, timely, and effective treatment. He has an in-depth understanding of legislation and policy, which makes him an effective leader in advocating for an end to stigma and discrimination based on sexuality and gender. And welcome, Herbert. I'm so glad you can join us. And finally, let me introduce you to Leah Odle-Benson, who will be moderating today's discussion. Leah is the acting director of programs at the Stephen Lewis Foundation. Previous to this role, she was the monitoring and evaluation and learning manager. Born in Barbados, Leah spent many years working in the Caribbean on gender and development issues, including violence against women, transformational leadership, and HIV and AIDS through the UN Women Caribbean Office. She's a former board member of the Redwood Shelter, where she served 5 years on their social justice committee. Thank you, Leah, and let me hand it over to you.
Thank you so much, Meg, and a warm welcome to everyone who is watching and tuning in with us today for this discussion on championing mental health programs for LGBTIQ communities. I feel very privileged to be a part of this conversation with our 2 wonderful guests. I will say that programs to support mental health and emotional well-being are so important as it relates to HIV and AIDS programming, and we hope to touch on that a bit more throughout this conversation. But especially in this moment of COVID, there's been increased uncertainty. And so before we dive into the specifics, I really wanted to just ask you both, from your perspectives, what's happening in the national context right now so we can just lay that that foundation for our audience here today. What's happening in Uganda and Kenya as it relates to HIV, to COVID-19? Kennedy, why don't we start with you?
Thank you very much, Leah. First of all, it's good to know that recently we've seen an increase in some of the cases, especially infection cases are now coming up again. Sometimes last month we were happy that the curve was going down, but right now again we are seeing cases are increasing. And as per today, we have recorded 49,997 cases, and we have 920 deaths in the country. And chances are in that, although the government has kind of put some measures to contain the spread of the COVID-19, but we feel that the measures are not enough, because when you see the cases coming up again, it's a clear indication that something is not right somewhere. Either people are not adhering to the measures, or people are tired of the measures, or people are completely total ignorant of the measures. So the situation right now, we are facing, there's a possibility that we'll be facing another lockdown if the cases continue increasing, because we had predicted that schools are going to be reopened very soon. But it seems that because of some of the cases increasing, already the government is also proposing closing down some of the school, like it has happened at the coast region. So we have fear, right? There's fear right now that we might be facing another lockdown, yeah, because cases are increasing. I'm sorry to say that.
Oh, thank you, Kennedy. And Herbert, what about you? What's happening in Uganda? I know that the government acted quite swiftly. What's happening there right now as it relates to COVID?
Thank you so much. According to the COVID situation in Uganda, cases are also increasing day by day, where we get new cases. So far, we have 11,621 new cases in Uganda for COVID, and deaths 64. But due to the SOPs, usually you find community members or the public, they no longer follow the guidelines, whereby you have to keep social distancing, you have to take your temperature, you have to use your face mask whenever you're getting out and all that. So I feel like because we are coming into the new normal, whereby people think that, feel like putting on a mask, it has to be under your chin, moving around and all that, and not respecting the COPs, I feel like it's causing cases to increase within Uganda. So I feel like in 2 months to come, we may also be under lockdown, although we still have curfew at 9 p.m. We have to be indoors. For schools, we are open for only candidate classes to see how they will measure and see if next year they can be, other students can be able to go back to school. But the situation in Uganda is still serious, whereby every day we register more than 50 cases in Uganda.
Thank you so much. And we can well imagine the uncertainty, the increased uncertainty that's erupted as a result of COVID-19. And many of our LGBTIQ partners have expressed to us that the lockdowns and restrictions have had really life-threatening implications and are taking quite an emotional toll on their clients and their beneficiaries, being cut off from their social networks, being cut off from their chosen family. Can you tell us a bit about what these lockdowns and restrictions have meant for your respective communities in Kenya and Uganda? And Kennedy, why don't we start with you again?
Thank you very much. Leah, to be honest, the COVID pandemic has caused a lot of havoc within the LGBT community. And specifically, as sexual minorities, we are still having challenges around acceptance. We are still having challenges around access to health. We are still having challenges around getting services freely. And with the COVID situation, especially for the LGBT community, it was very hard because some of them were forced to go back to their home areas and living with people who don't conform or don't conform to their sexuality, people who still discriminate them, people still don't approve of them. If you look at the traditional sources of support like families and religion, where we are still facing possible discrimination, then it was very difficult with COVID situation. If you look at in terms of health, I'm running a program where we have over 300 gay men living with HIV. And with the COVID, most of them could not access health services. Most of them could not access their PrEP. Some of them could not access their ARVs. And some of them could not come to the DICE to access services. So it was really, really challenging. So some of them defaulted on their medication. And also right now from the program perspective, we have seen an increase on STIs. So it's a clear indication that even prevention commodities have been a challenge during this period. It means that people are engaging in sex, people are seeking accommodation in exchange of sex, and getting the necessary prevention commodities is a challenge. So the STIs is a clear indication that we are really facing a problem. And there's possibility of reinfections also, because for the last 1 month, we've been doing some research around HIV/ST. And we are seeing members coming for the research where we have a biomedical component where you have to test for HIV. We are also seeing positivity rates that are coming with the new research. So it's a clear indication that things that are not good have happened to the community. We've seen incidents of violence because be that at family level or even at community level within sexual partners, we are seeing a lot of violence. We've at MAAYGO we have received 77 cases of partner violence, and it's really traumatizing, especially during this time. And we are also seeing a lot of community members who cannot even get food to eat. And we have someone on ARVs, they cannot even get a proper meal because some of them have lost employment, some of them have lost their source of income. So as MAAYGO, we have a lot of work to ensure that we support them in one way or another. So these are some of the challenges we are facing at community level and also at organization level. Yeah.
Thank you so much, Kennedy and Herbert. For you, is it, are you experiencing similar issues? Are there similar challenges happening in your working with community at this moment?
Thank you so much. Yeah, we are experiencing the similar issues in Uganda also, but when it comes to LGBT, we are being stigmatized, discriminated year by year. So the impact of COVID, when COVID came in, it was like, and it went higher, the discrimination and the stigma, whereby there was a reduction in accessing health services, especially for those people who are living with HIV in the community and those on PrEP, where you would find community members, they will be calling you, where can we get our drugs? We cannot walk because of the lockdown. Where can we access the health services we need right now? And also we had also social isolation, whereby community members were forced to go back to their homes, well, to their family, who would discriminate them because of their sexuality. So they had to bear the abuses, the stigma, all that. So because to stay in a safe space where they know they will be provided with food, they will be provided with shelter, but at the end of the day, that shelter and food came with an effect on them. And also we had an increase of STIs within the community, since there were community members who didn't have anything to do. They would engage in sex and also would not access health services they need, like condoms and lubricants. And also an increase in intimate partner violence within the LGBT community, whereby the dependent would be violated, where you find that, yes, we have been dating, but we have never been together for like more than 2 months. Right now we are together more than 2 months. Such difference within the partners would create intimate partner violence. And when they would call in that, can we get access of help? How can we be helped? By the end of the day, that their partners were providing them shelter, and they would not leave because they didn't want to go back to their families or homes because of different issues, because of their sexuality and all that. And also the increase of mental health issues like anxiety, depression, about the news going on, about the COVID situation, about the lockdown. Where am I going to get a job after the lockdown? What am I going to do? Where is the food? Because I don't have any food to eat. All that led to mental health issues, whereby people had depressions, and anxiety and stress. And also we just had some cases of self-harm, where people wanted to self-harm themselves so that they can reduce on the pain they were feeling in that moment. Because like one of the clients was telling us that, for me, when I cut myself, there's a way I feel like the pain has reduced and I can move on. But whenever the wounds heal, I feel like cutting myself again. So all this, it was due to the impact of COVID. Members didn't have anyone to associate with because the social distancing and all that, the lockdown, the restrictions from the government and Ministry of Health also, whereby some other community members had to walk to go to the health centers to access health services. So that made them hard for them to go and access health services. So it impacted a lot on the LGBT community so much. To an extent, we were able to get support from OHI, and we registered over 19 clients during the lockdown period who we provided with mental health, whereby we had 768 who had symptoms of depression and stress, 449, anxiety, 637, those who were on alcohol abuse, there were 65, and those who attempted to take their life, there were 48. So you would see the impact of COVID was really hard on the LGBT community members in Uganda.
Thank you so much, Herbert. This is such vivid examples. And I suppose the question we have is, with these compounded realities of increased intimate partner violence committed by family members, decreased access to medications and health services, decreased connection with networks and supportive networks. How have you at IBU had to pivot to support these changing needs of the community? And can you tell us a bit about what programs and services you feel like you've had to adjust and adapt to meet these changing realities? Like, what's working well for you right now, and what has been particularly challenging in trying to address the lived realities of anxiety and depression that are emerging as a result of a very difficult context in this moment? And Kennedy, you can think on that for a bit as well. And Herbert, do you want to touch on that?
Yes, for IBU, since at Icebreakers Uganda, we have a team which is committed of working within the community, serving the community. We came up with different initiatives. For example, during the lockdown, whereby we would just walk to the IBU offices, to the clinic, like 3 times in a week. We'll just walk so that we can go and serve our clients on appointments. And also we came up with a new initiative of WhatsApp groups, whereby different members would be sent a link to join a WhatsApp group if they need psychosocial support. Within those groups, we would place mental health provider as well as counselors to give support to the community members who need to discuss on different topics, whereby every morning or evening, the provider would ask, how are you feeling today? How is the lockdown treating you? Beneficiaries would react different to different questions, and they would give them different tips on how to make their day lovely, good, and all that, as well as share lovely music, comedies, so that they can keep them laughing, so that they don't feel like they're alone in this situation. Also, we had a media service provision, whereby we had an initiative also called Ask the Doctor, where I would go live with a doctor, and community members would ask the doctor about how stress is affecting them during this lockdown and all that, and the provider would answer different questions. Also, we had a chance of inviting different personalities to talk about how COVID is affecting their communities, like the male sex work community, the sex work community, as well as the LGBT. And also we invited the IT specialist. How can we use IT in this time of need, or that in line with the mental health? And also we started extending our services for mental health in terms of outreach, but would meet only 10 people because of the SOPs, where I would not allow to be more than 20 people. So would create small groups of not more than 10 people, where they can discuss, share, and all that. Also, we started reaching out to our clients by calling them, those who had issues, where they would send in different messages, and the response team, which included the mental health providers, they would call in and check on them. They have sessions with them and all that, because it was so helpful. Then from that, it led to us getting a toll-free line, whereby community members can call in freely, so that they can be able to talk to the clinical psychologist, so that they can feel well, and as well as to make appointments at IBU clinic. And we also developed a guide, which is called Not Alone, a crisis response guide for LGBT community members. This guide, it's going to be used by different LGBT organizations as well as beneficiaries, and this is how it looks like. So we feel like this guide is going to be something very helpful, because this is a very big tool to our community. We don't want our community to feel left out. We are here where they are not alone, they are with us. Because at the end of the day, our community, it's our community. And also we increased our referrals in different mental health departments. And also we are trying our level best to work with the National Mental Health Hospital, which is called Butabika, the National Referral Hospital for Mental Health in Uganda. We're trying to see how best can we work with them, because during the lockdown, we got a challenge whereby some community members who had mental health illness their drugs had got done. So we had to find a way of getting them drugs so that they cannot relapse, so that they can adhere well to drugs. And also we came up with DRN support groups on WhatsApp to support community members who are living with HIV during the hard times. And also we are able to, through different funders, we're able to provide food relief to people living with HIV, as well as those who lost their jobs because of the lockdown.
Thank you so much. Thank you so much, Herbert. And Kennedy, I'm going to extend the same question. You know, what strategies have you had to put in place to support the lived realities of your community in this moment as it relates to mental health? And what programs and services do you feel like are currently working well? And what's been challenging in having to make this pivot in the work that you're doing, and to add this new dimension to the work that you're doing?
Oh, thank you very much, Leah. Actually, when the government came up with measures, especially the curfew and the social distancing and staying at home policies, we went into a panic mode. People went into a panic mode. We didn't know what to do or where to start because nobody had clear information of what exactly is going on. So for MAAYGO, what we did, we closed down the office. Our first measure was to close down the office and then try to look at what are now the best strategies now to ensure that there's continuation of service, and if our members are able to access the services on time. So what we did is, first of all, we mapped out some of our beneficiaries who are completely affected with the COVID situation. And especially we gave first priority to GBMSMs and male sex workers living with HIV because we felt that it was a priority because for us, they were the most vulnerable population. And one thing we did, we secured a motorbike. And through this, we could do the door-to-door. We could do the door-to-door services. In that we could deliver, our health service provider could deliver the ARVs, they could deliver their PrEP, and deliver HIV/ST kits for those who are in need, especially for those who could be reached at that particular time. But for those who could not be reached, then it was really challenging on how best we can support them. Another thing that we invested on was the online support group meetings. We created a lot of platforms where our community members can access online counseling, and we stationed our clinical officer to be standby to provide services, especially if people would call in, they would provide services immediately. Then we also ensure that our support team would go to the MSMs who are living with HIV in different areas and group them in different areas where they're coming from, and they would offer them that psychosocial support that they need at that particular time. For MAAYGO, again, we also ensure that if our service providers were going out to provide these services, then they have to take into action all the measures to prevent COVID. They were required to put on masks, they were required to have sanitizers, they were required to also maintain social distance whenever they are going to engage with the clients at their homes, because that was the strategy that we could come up at that particular time. But the most important thing to mitigate on the mental stressors, one thing was just to link up. We could, our clinician could do the assessment, and then people showing symptoms of being mentally stressed or mentally having issues to do with mental issues or stressors, then would refer them to government hospitals or to government expertise or people who would support them further from there. Because we find that the much we could do at that time, that was the much we could do at that time, because we are still in a confused state. Like, what would be the best strategy and how would be the best measures to put in place to ensure that our community members are getting the services that they need. But I think for us, that has worked so much, and we've really managed to reach out to our communities. Most of them have continued to access services. The only numbers that suffered at that time were those who were with the curfew, that were in places where they could not access transport and either come for services, or where our service provider could not reach out to them. So that was the most affected population. But right now we are making all the measures possible to ensure that we've tracked them down, to ensure that they are able to continue with their medication, they're able to continue to access services. Yeah.
Thank you so much. And you speak to this confused state, and that is what COVID-19 has in fact inflicted, right? It is a very confused state of being. A lot has had to happen in such a short period of time, and there's so much growing uncertainty. And Herbert, you spoke to this as well. The organizations that you represent are founded in community, they are grown and nurtured in community, they're developed by community. And so from your experiences, there's implications that has for the staff and for leadership within the organization. Can you tell us a bit about how the mental health needs are unique in this moment of COVID-19 specifically? Are unique to leaders and staff in relation to community members, or how is the staff and leadership in your organizations doing in this moment of confusion, in this moment of uncertainty? How are you all doing?
Yeah, at first, when we started getting cases of COVID, our staff members started getting scared, and you would relate with other organizations who are also like scared about what's next. Are we all going to get affected? Are we going to be left without jobs? How are we going to reach out to the community members? And sitting back being the frontliners, because health providers are the frontliners in different organizations. Because standing on the front line so that you can defend and provide services to your beneficiaries, something which is sometimes draining. Because every time beneficiaries think that, yeah, someone is working at Icebreakers, for example, so this person has to fulfill all my needs. So sometimes you find that it's draining, whereby they think that an LGBT activist should not rest until their beneficiaries are doing well. They should not fear. They should not what, all that. And also finding like in our clinic where you find that counselors, staff members keep on talking to different clients, giving them advice, counseling them, reaching out to them, delivering their drugs and all that. Sometimes you find that this is draining and it's burning them a lot, whereby even they cannot stand up and say, I need help. Because, for example, I'll just give myself as an example. Most of the time, I'm always on the front line. So you would find that I don't have that space whereby I would sleep for like 8 hours, or I want to go out and listen to music and all that, because I'm here on my desk thinking about that tomorrow, or what are the beneficiaries getting? Are the drugs there? Are they receiving the services they need to have? Have they taken the refills to different clients to this week, all that? So you feel like that sometimes it drains you, and there's a way it causes mental health issues. That's why you find most time staff members get depressed, and you ask them, why are you depressed? They will say, I don't know, because they don't want to share that. They don't want to share how they feel. They feel like when I share something, that means I'll be losing my job, because this is my job. I'm a clinic manager. I have to make sure that all clients get the service they need, without forgetting that if they don't put their health first, they're not going to serve the community also. So there is need for staff members, organization leaders to put themselves first also. Yeah, I know, yeah, this community, we are being discriminated, stigmatized every day. But at the end of the day, you are carrying a burden of more than 10 people. So how can you reduce on that burden? How can you reduce on the burden? So it's time for us to put our steps down and say, yes, this is what we can be able to do. Like for example, at Icebreakers, every quarter we'll be having a staff debrief to share about what is going on in our different departments. How stress, how is depression, how is COVID-19, or the new normal affecting us as leaders before we step out to lead. Because they don't want a leader who's going to start leading and he faints on the way. So there is that need to start giving support to LGBT organization leaders in terms of initiatives like staff debriefings. They are very important, whereby all staff members can go in a place which is quiet, maybe near water, so that they can discuss on how their quarter or the 3 months have been. So with a professional clinical psychologist, so they can be able to share together, because group sessions are being, they show a lot of impact compared to one-on-one sessions, group sessions where like you all have the similar problems. So how do you come up with a solution? How do you move forward? So there is need for organization leaders to be supported in terms of staff debriefs, to leave office and go to an area which is not surrounded by clients, surrounded by medicine, surrounded by office work, so that you leave your desk and go somewhere where you can interact with your friends, where you can synergize with your different staff members so that you get ideas and all that, as well as cleansing your mind, your soul, and everything. So, yeah.
Thank you so much. And I just want to take a little quote from your resource, Not Alone Crisis Response Guide for LGBT community members. And it says, healing takes time, but asking for help is a courageous step. So Kennedy, I want to get a sense from you about, what is your vision for the work given this reality? What would you like to see happen within the context of your work? And how can us in the international community support LGBTIQ organizations in achieving this vision for themselves around increasing access to mental health supports for their communities, destigmatizing issues around mental health and well-being? How can we support you as a collective?
Thank you very much, Leah. I just want to echo what Herbert has talked about. Actually, as leaders, I'm sorry to use the word, people look at us as messiahs. And you carry a big burden on your shoulder. Looking at the beneficiaries and community members also rely on you. And apart from that, if you go back, we have families. And because of the stigma and discrimination, we also work extra hard to buy love from our families. You see, you are trying to provide, you are trying to overdo everything for your family because you want them to accept you back. You want them to love you. So it's like you are buying love for you to fit in your family. And if you look at all these issues, at long last they toll up and becomes kind of a mental health issue. And since most of us, we don't want to admit we are going through challenges, we want to keep them internally, we end up either self-medicating, and that's why you find that issues like addiction come in. You want to take alcohol as a coping mechanism, you want to use substance as a coping mechanism, and sometimes you are not careful, these things can lead to suicide. So one thing I'd really love for Stephen Lewis to understand is that, first of all, one thing I'd really love to make clear is that the mental health service within the LGBT organization sometimes is not even there. We are just coming up with measures. We are just coming up with measures to cushion this problem. And this could either be support groups or group meetings, or maybe doing some physical activities. But in real sense, we don't have therapists. We don't have therapists who are knowledgeable around LGBT stressors, LGBT issues that can provide that support. And if at all we have those therapists, then you find that some of them they have stigma within them. They look at you as a sexual deviant, they look at you as somebody who is sexually disturbed. So providing you even with that service is also a challenge. So one thing I'd also love is for us to do is to invest. Let us invest in this organization so that we can give quality training to LGBT persons who are qualified to provide this kind of services to the LGBT community. Because an organization like MAAYGO, we know issues around HIV. We know issues around psychosocial support about those living with HIV. But the mental health component, it's a completely different thing that really needs to come in, because it also supports the well-being of activists. And when you are mentally stable, it means that you are living a healthy life. It means that you will be productive. It means that you'll be able to be successful in life. And also, most of us also don't think about activism. Yeah, you are in an organization, you don't even think about your future. You don't even think about you need one day you will retire, and maybe you need somewhere to relax and reflect. You know, this kind of things. So it's also good for programs to invest in this kind of programs. Come with initiative to ensure that group leaders or organization leaders also have ways to cushion themselves post activism or post this kind of work, because it is hectic. It's really, really hectic for community members. Then it's also important to ensure that we really increase spaces for LGBTI, because the stressors are coming as a result of the stigma and discrimination. If you can have programs that are really trying to increase spaces for LGBT, is trying to increase understanding, or people understanding who the LGBT persons are, as programs that are trying to enhance human rights of LGBT, then you'll find the stigma and discrimination going down. And this might create a conducive environment for a person who calls themselves LGBTI, a leader within the LGBT community, to freely express themselves and enjoy who they are. So if we can also come up with programs that are really trying to decrease stigma in the community, then I think it's also one way to ensure that we are getting spaces where we can express ourselves, we can live freely without fear of some of the issues we are facing. And for me, I've seen a lot of challenges in the program, because right now, like a good example, during the COVID, we were receiving calls from all over. People want their support. People want us to be supported with house rents. People want to be supported with food. People want to be supported with medication. People need money to go for treatment. And you find that as a program or as a person, as a leader, you are not capable, because some of us also find some of our donors are very, very restricted. We find we get funding that are very restricted, that you cannot reallocate funding to do a different activity that was not intended to, because those are some of the challenges that come. So it is also important that even our partners understand that we need to have extra money somewhere to see how to support this kind of structures. And I think also the best is also to come up with the economic empowerment program. Because once we come with the economic empowerment programming or sustainability programming for organizations and also for individuals, this also creates room to generate extra income for the organization. Then you can support this kind of program. You can support the food initiative, you can support the treatment initiatives. If people don't have, you can buy their STI drugs. If those drugs are not available, you can see how to support those who have been evicted. You can also support yourself as an activist. Go somewhere, just relax, reflect with community members, with other leaders, and to just re-energize and get that energy and that your sense of purpose as a leader and as a community. So that is my take.
Thank you so much, Kennedy. And Herbert, for yourself, what is your vision of comprehensive mental health support for your community at IBU? What would you like to see, and how can we collectively support you in executing this vision for yourselves and for your community? What do you feel is most needed from the international community in this moment?
Okay, what we really need as Icebreakers Uganda or within the community, the LGBT community, it's make sure that people who are affected by mental health issues are really getting the help they need, the services they need, because it has taken us years and years talking about mental health, but people say that they put it on the side. That's not an issue. That's a white man's issue, not black guys' issues or that African issue. So this is time for us to stand up and we say that mental health really exists in all communities. But when it comes to LGBT community members, it affects them a lot compared to the other community. So we need to come up with manuals to use to train peer educators so that they can give the services to the beneficiaries, come up with tailored service for LGBT. Like, for example, HIV, we have been talking about HIV for, I don't know for how many years, but right now, even when someone can stand up and say, I'm a person living with HIV. So we want that time when someone can stand up and say, I'm a person living with mental health issues, and I'm a champion. I'm here to champion for people who are living with mental health issues. But how are we going to do that? So there is a need for donors, all supporters, to start investing in mental health. Like the theme for this year, mental health for all, let's invest in mental health, because it's something which they have put on a side. It's time for us to start thinking about investing in mental health, because we need to carry out outreaches, we need to carry out face-to-face interaction or sessions with community members who are really in deep depression and anxiety. But how can we bring them back? We need to create awareness about mental health. For example, like last year in October, Icebreakers also launched the first mental health research ever done in Uganda. So we are working on our web-based, like, to build publications, bringing different research about mental health so that people, community members and stakeholders in Uganda and outside can be able to know that, yeah, mental health exists in Uganda. And also coming up with initiatives to help organization leaders. Like, it can be like LGBT leaders debrief, where all LGBT community members in Uganda, they meet in a place for like 2 or 3 days. So they can be able to share with each other what the issues they have been going through over the year. Something which looks like a staff retreat, but not a staff retreat, because staff debrief or leadership debrief, it means like putting leaders in one place and talking about issues around mental health. And also coming up with tailored services, like having a clinical psychologist in health centers which are LGBT friendly. Because right now we would want to refer someone to a national referral mental health hospital, but we cannot, because we fear the stigma the person will be going through, or the stigma. So there's also need to do advocacy in mental health so that we can be able to sensitize the clinical psychologists about LGBT issues before coming to offer services to the LGBT, because you would get someone who is good at counseling, good at everything, but the person will be not knowing anything about LGBT, and people will be like, you brought someone who is stigmatizing us, so you are adding or tripling the issues. So there's need to create more awareness about mental health.
Thank you so much. I can see from what you're both saying that the need is great, and it's very nuanced and very specific to the needs of your communities in this moment. And I wish we had more time to continue conversations. I know that some of the audience have some questions for us, but I just want to end our kind of conversation just asking, just in 1 minute or so, like, what in these moments continues to give you hope for this work that you're doing? What continues to inspire you about the communities that you work in and that you work with and that you're part of? What keeps you motivated and inspired in moments like this?
Thank you very much. For me, first of all, I say that what inspires me, first of all, is the visibility, the community, the LGBT community that is existing in Kenya or existing in Kisumu County. Because without this community, then we don't have people to serve. And the fact that majority of us are coming out every day, it gives us the energy to continue working, to ensure for people to know that we are LGBT people are being born, LGBT will continue to exist, and
dear, I think we may have lost Kennedy just for a moment. Herbert, in the interim, would you like to touch on this in terms of what keeps you motivated, inspired, and moving forward in these moments?
Yeah, I think there are three to four things which keep me inspired to do the work I do. One of it being that I'm a victim of mental health. I've gone through. I lived with mental health. Even I'm currently living with mental health. But that inspires me to empower others who are living with mental health, telling them that you are not alone. There's someone there. I'm also here, a victim of mental health, but the way I live my life is to empower others so that they cannot go through what I went through. Although I had support from my family, but the others who don't have support from their family. And also that team I work with, it's so wonderful. Every day they make sure that, yeah, Herbert, how are you doing? How are you feeling? And all that. And I thank so much the team we have at IBU because they're always there for each other. No matter what, they're always there for each other. And lastly, the community I serve. Getting a thank you note or someone meeting me and saying, thank you, Herbert, for the work you're doing within the community. That pushes me more and more to do more within the community.
Thank you so much, Herbert. And I think we may have lost Kennedy. We're hopeful that he'll be able to rejoin us soon. But I know that the audience has some questions. And so Meg, if you could just let us know what's coming up from the audience.
Sure, we actually have quite a number of questions and I'm just very conscious of time as well. I know that you've had a chance to answer some of them that have come up in terms of, what kind of support are you looking for from international communities and how people can provide support outside of financial support as well. We can address some of that. There's also, maybe you want to speak to this a little bit more, Kennedy, just briefly, sorry, not Kennedy, Herbert, just briefly. You talked about the National Hospital for Mental Health and trying to find a connection there. What do the broader mental health support system, what does it look like in Uganda? And is it a system that you're able to connect to? Is it provided by the government or are there challenges or does it exist at all?
Thank you so much for that question. On the national referral hospital for mental health, which is Butabika, usually it's a governmental hospital, but you would find that most of the staff members or health providers working within the center, they don't know anything about LGBT. If they know anything about LGBT, they will say that being an LGBT person is also a mental health issue. During my first research, See the Invisible, where I interviewed one of the doctor at Butabika, where he said, no, people who are LGBT, they're living with a mental health issue. So that comment, there's a way it affected me to an extent, like a psychiatrist, a professional psychiatrist who went to school, who knows that a person being an LGBT, it's not a mental health issue. So I feel like most of the time they tend to forego that part and they just leave that part. Or maybe during their study, they don't teach them about that section about sexuality, like it's not a mental health issue. So you'd find that it's very difficult to penetrate within the National Hospital for Mental Health. Like, for example, during the research, you would find that someone would love to go to be admitted to that hospital, but someone would feel like, yeah, I'll be admitted, but at the end of the day, I have a different issue and I'll create more issues. Another thing, I have seen some friends of mine, their parents taking them to rehabilitation centers so that they can be treated for being LGBT. So that really scares me a lot. Because when a parent just gets his or her son and they take them to a rehabilitation to be treated for being LGBT, and there is a professional person who is doing that, giving the person medicine that you will forget, you showing the person pictures of naked pictures of women or men so that they can get that reaction. All this traumatizes me. So there is really a big need to penetrate within the government to talk about these issues, that mental health for LGBT, it's like any other mental health for any person. So stop discriminating us because of us. Just treat us, because we come to you because we have a heaviness on us for stigma and discrimination from the community, from the society we live in, from within the LGBT community also. But when we come to you, instead of treating us, you also add on us. So that's something we, as IB, we're trying our level best to do, and also to work with other private mental health institutes to sensitize them about LGBT issues. In case parents or friends, they take their family members to such rehabilitation centers, they can be able to say, we cannot treat this person, there's nothing wrong with this person. So we want to be the advocate to make a change when it comes to mental health within the LGBT community. We want to stand on our feet and we say, enough is enough. If we want a service, we want to go to get a service and get out. You offer us the service and we get out, but not you bringing your Bible and telling us how it's a mental health issue being LGBT when it's not. So there is need to sensitize psychosocial, psychotherapist or mental health provider about LGBT issues. Also to sensitize or meet with heads of different mental health, private and public hospitals, to talk about LGBT issues, to talk about how can we create this synergy between us so that we can be able to refer our clients to you, and also you can be able to refer clients to us. 2 years back, there is a parent who walked in at IBU with a son and said that I've been looking for you. I was able to get your link on Facebook and it brought me up to your gate. I just brought my son so that you can cancel my son, because I know my son, he's different, he's gay. So we want to reach to that extent when also parents can come to us and say that we need your service. We need your service. We need to sit down and we talk with parents also, because they also lead to mental health issues like family rejection. There's nothing which hurts more than your family rejecting you because of who you are. All that. Like in the last 2 months, I've been meeting parents of LGBT community members, talking to them, getting to know their issues and also trying to explain their issues. Yeah, I know that they don't understand us better and we also don't understand them, but we need to also create that, to bridge that gap so we can be able, they can be able to understand us, and also we can be able to understand, they can be able to understand, we can be able to understand them. Because I dream of that day when we are just marching on the streets of Kampala with our parents shouting, my son is gay and get over it. Thank you.
Thank you so much, Herbert. And I think Kennedy has rejoined us. Kennedy, can you hear us?
Kennedy? I can hear you, but unfortunately, I'm still in the darkness.
Okay.
All right.
Just wanted to make sure you're there.
Well, I think, thank you, Kennedy.
The electricity has gone. I think the electricity, there's blackout all over the county. Yeah, so the electricity has really gone off. Yeah. But
another challenge that you face in your work. Did you want to finish up your message around what gives you hope? I mean, I think.
Yeah,
Herbert,
yeah. One thing I'd also love to say that in Kenya we have a very comprehensive constitution. And I think it gives us a good platform to continue advocating for our issues and also to ensure that the LGBT persons have a place in the society. And also I'll say that there's a lot of partnership that we are also creating, looking at at the key stakeholders like the Ministry of Health, the Kenya Police, the local authorities. We are now also trying to reach out to families, because families have been traditional source of support to LGBT persons. And I feel that if families can be sensitized, if we can involve families in discussions around mental health, in discussions around well-being of LGBT persons, then we have a good ground to ensure that our community have access to health services, to mental health services, and the overall well-being of LGBT persons. So I'll say that it's a motivator, looking at the work we've been working all along, and at least we are making some strides. We cannot say that the situation is bad as it used to be. It's only that we are still having gaps around the legal aspect. We are still having gaps around acceptance. We are still having gaps around mental health issues. Is a very big issue. So it's something that we really need to still continue working and advocating for. Yes.
Thank you, Kennedy. Thank you. I realize we've gone over time, and what you've described to us, both in terms of the challenges faced by the LGBTIQ communities that you work with, but also the work that you do, what inspires you, I think has been very powerful to hear from you today. And so I really want to thank you for coming and sharing with us your experiences. You've given us a lot to think about in terms of mental health and how we can provide you with further support, and how I think as a global community we can do, through advocacy and awareness raising and providing you with resources as well, help to change the conversation around mental health, so that it's recognized as a challenge that every community faces to some degree, and that we have to ensure that the supports are there for everyone who might need that support. So thank you very much. I do want to invite anybody who has attended the webinar to, if you are interested, to support the work that Herbert and Kennedy are discussing, and to help expand that support, to please connect to our Partners in Pride campaign as well, and you can learn more or make a donation there as well. And if you want to make sure that you're invited to future Pride Talks, on our website you can sign up for the newsletter at stephenlewisfoundation.org, and you will get an invitation for the future Pride Talks as well, and you can continue to learn about the experience and the powerful work of our partners in sub-Saharan Africa. So thank you very much, everybody. Thank you, Leah, for moderating today, and particularly thank you, Herbert and Kennedy. Really appreciate you being here.
Thank you both. It's been a real privilege. Thank you, everyone.